We do know that the further that we go from metropolitan areas, the more remote we get, people have poorer health overall. Some of that has to do with the social determinants of health, so around education, housing, economic status. But some of it also has to do with the way in which we deliver services. If services aren't available early or people don't know what services they need, then it's more likely that they will access services later. So by the time they arrive at a service, whatever the condition is that they're experiencing will be much more chronic and much more difficult to treat. That's the same with physical health as mental health.
The impacts of this deficit that exists in rural, remote and regional areas means that many families struggle, and it really impacts the whole family. So it means that one person not accessing or not being able to access these mental health services has an ongoing effect within that family, the extended family and also the community.
I guess one of the really important things is not to see everybody in regional Australia as the same. There's obviously huge variation, cultural variation, age variation, and so we need to understand the ways in which we can better support people early and move that trajectory away from developing into a chronic mental illness and back to resilience and support when and where people need it.
When we think about the needs of regional Australia and mental health, often we think that we have to go really big in order to create change. But I think that change can happen on a really simplistic level where we think about connection and belonging, where we consider the ways in which we promote conversations about mental health early and often, that we provide safe spaces for people within those priority population groups to be able to talk about what's happened to them, and then also think about the health systems that need to be in place to receive people when they need care.
My research is in the area of defence families, for military families. We have built a suite of resources that are free that educators, family workers and parents can access to understand the types of supports and protective factors that will be effective to support children who often live in remote, rural and regional areas as part of their defence life.
The Regional University Network, which the University of New England is part of, put together an idea to say, let's do something different in mental health. We came together and looked at how could we do something different, something big, really start addressing some of these challenges of mental health and mental ill health in regional Australia, and different to the ways in which we think about that from a metropolitan perspective.
I always think that as a health researcher, the biggest thing that you can see is the ways in which your research is translated into the community. So I would love to be able to see the fact that people can make choices about who they tell when they're struggling, that somebody receives their phone call or their in-person connection, that understands that our goal isn't always when someone says that they're struggling to fix it for them, but to remember to just sit and listen to people's stories and not just always consider what does that person need today, but what's happened to them across their whole lifespan to truly understand how they arrived in front of you at that point. So I'd really love to see more compassionate and engaged and connected communities.